Well, hello there, and welcome to Medicare Made Plain, brought to you by AssureSource. In our previous video, we started building a foundation of Medicare knowledge, and we started with Medicare Part A. So today, the most logical and obvious place for us to go with this video is to begin talking about Medicare Part B. So, thanks for stopping by our little place of business, and let's get into Medicare Part B. Before we get into the details of Medicare Part B, I thought it would be appropriate for us to take just a few minutes, like we did in the other video about Medicare Part A, and talk a little bit about all of the A, B, C's, and D's of Medicare so that you can get kind of an understanding of where Part B fits in. Well, like we talked about in the other video, Medicare Part A stands for your hospital coverage. So if you're admitted into the hospital, it is covered under Part A. Part B then, which is what we'll talk about mostly today, is your medical coverage. So if you go see a doctor, you go see a specialist, you have anything done outpatient, it's going to be covered under Medicare Part B. Medicare Part C is Medicare Advantage. And then Medicare Part D is your drug coverage. So again, when we talk about the A, B, C's, and D's of Medicare, Part A is your hospital insurance, Part B is your medical insurance, Medicare Advantage falls under Part C, and then Part D is where most of your prescription drugs are covered. But today we're going to dive into the details of Medicare Part B. So as we begin to talk about the details of Part B, let's start with what Medicare Part B covers. The first thing is this has outpatient care from doctors and other providers. That's a real fancy way of saying if you go see your primary care physician, if you go see a specialist, it's covered under Medicare Part B. But also anything that you have done in the hospital that is outpatient, whether that be an outpatient surgery or maybe some testing or an emergency room visit, those are all going to be covered under Medicare Part B because you're never admitted into the hospital. The second thing that it covers is home health care. You know, we talked about Medicare Part A in another video, and if you've seen that, you'll remember that home health care is also covered under Medicare Part A, but that is when it is following a 3-midnight hospital stay. For it to be covered under Medicare Part B is going to be any home health care that does not follow a 3-midnight hospital stay. Had a client this year that had to have some rotator cuff surgery, but when she had that surgery, it was done outpatient. She needed to come home and have some rehab done in the home. Because she was not in the hospital for 3 midnights, it was then covered under Part B. Durable medical equipment. Most people see DME, they think of things like walkers, they think of wheelchairs, they think of maybe even canes, things of that nature. Some things that are going to be DME that you may not think about are going to be things like oxygen for folks with COPD. If you have sleep apnea, the sleep apnea machine, all the stuff that goes along with that is also going to be covered under Medicare Part B, durable medical equipment. So any type of equipment that you need for your health care is going to be covered under Medicare Part B. Observations. If you've seen the other video, we spoke very briefly about observations and how they have become a huge part of healthcare in the United States. Observations following the Affordable Health Care Act became a very prominent tool in billing for hospitals. The reason is, before the Affordable Health Care Act, if somebody was in the hospital today and they sent them home, if they had to go back to the hospital in 2 weeks, the hospital got paid the same amount of money for both visits. Now, because of the Affordable Health Care Act, they feel they should have taken better care of you the first time, so the hospital does not get as much money on that second second visit. But anytime you create a law, people are going to find a way around it. And that way around it is observations. They can hold you in the hospital for up to 72 hours without ever admitting you into the hospital. This usually looks like this. Somebody goes into the emergency room. They need to be admitted, but they say, we don't have a room available. We don't have a bed available. So we're going to put you over here for a little while. And that is an observation. The problem with that is that because you're never admitted, it never goes into Medicare Part A. And we'll talk about the cost sharing in a minute about Medicare Part B, but it's 20%. And so 20% of a 72-hour hospital stay can be really absorbent. So we want to make sure that folks know they need to have observations covered before they run into that down the road. The next thing that's covered under Medicare Part B is going to be some medications. You know, most people think that all medicine falls under Part D of Medicare, and most of them do. However, any medicine that goes into your body through a machine is a Part B drug. And when I say machine, I don't mean an injection, I don't mean an inhaler or anything like that. It has to be a mechanized device. The most common uses for this is going to be things like folks who have iron deficiencies that a pill doesn't really work for them. They may have to have an iron infusion. That's going to be a Part B treatment. Anything that is done that has to be on a drip or through an IV is going to be a Part B drug. And then one other thing is covered under Part B that we really talk about more than we used to, and that is going to be chemotherapy. If somebody has cancer, cancer is something that's near and dear to my heart because of my life experience. And so someone has cancer, chemo it being a Part B drug, an average round of chemo in 2025 is around $21,000. Again, that cost sharing at 20%, that's something that we want people to know to have covered from day one, because the last thing they need to be thinking about when they hear that terrible C word of cancer is how are they going to pay for it. So we want to make sure that they have those types of things covered from day one because they fall under Part B as a Part B medication. Some other Part B medications are going to be, we've seen some new ones come out the last couple of years for folks with autoimmune diseases. Also for folks who get their insulin through a pump. Okay. However, due to some changes in Part D, we now see that even if they get their insulin through a pump, the maximum they can pay for that insulin is $35 a month. So it's not quite the problem that it was even 4 or 5 years ago, which is a very good thing for folks who are type 1 diabetics who get their insulin through a pump. And then also some preventative services. These are going to be your mammograms, your pap smears, your colonoscopies, vaccinations. As long as it's done preventative, then it's covered at 100%. So as long as even with one of the big ones for this is going to be a colonoscopy. If the hospital keys it as preventative, it's covered 100%. But make sure that they don't key it as diagnostic, because then you would have to pay 20% for that test. So these are the things that Part B covers. So let's talk a little bit about what Part B costs. So as we start to talk about the cost for Medicare Part B, the first place for us to start is going to be what is the premium for Medicare Part B. For 2025, the premium for Medicare Part B is $185. So as long as you're getting your Social Security, or you're going to start your Social Security at 65, your Part B premium will automatically be taken out of your Social Security check. If you're like a lot of folks and you're going to put off your Social Security to 67, 68, even 70, you'll have to manually pay for that. They'll send you a bill, and one thing to remember is they'll send you a quarterly bill. Now you can call Social Security and give them your checking account, and they'll take that premium out of your checking account on a monthly basis. A lot of folks don't like to think about giving the government their checking account. However, I always kind of chuckle and say, if the government wants your checking account, they can probably get a hold of it. So if you want to have it taken out monthly, you're welcome to do so, or you can pay a quarterly payment. As far as what you pay for care, every year you'll have a deductible. The deductible for 2025 is $257. So the first time you go to the doctor, you have a test run, anything like that, you're going to pay the first $257 each year. It goes up a little bit every year, but for 2025, it is that $257. Okay? Once you pay that $257, Medicare then pays 80% and you pay 20%. So once you pay your deductible and you get a service that is, let's say, $1,000, you pay $200 and then Medicare pays $800. But just like we talked about under regular Medicare Part A, is that Medicare Part B does not have a maximum out-of-pocket. Okay, that's why most people will either have an Advantage plan or a supplement to at least give them a maximum out of pocket so that there's a number that where it caps off at. The reason is, and it's actually a little bit more scary under Medicare Part B when we talk about those Part B drugs, if somebody has cancer and they're getting 4 or 5 rounds of chemo, you know, when you're looking at $5,000 or $6,000 a round, you can very quickly get into the tens of thousands of dollars for that cancer treatment. So we want to make sure that you have something in place to put a cap on your Medicare Part B costs. So just like we do in every video, let's talk about what does this mean to you. Well, put simply, it means this, that if you have Medicare Part B, you do have coverage if you need to go to the doctor, see a specialist, have a test run, have one of those Medicare Part B drugs that goes into your body through a mechanized device. Sometimes home health care, all of your durable medical equipment is going to be covered under Part B, and all of your preventative services then are going to be covered under Part B as well. But remember, there is no maximum out-of-pocket when it comes to Medicare Part B. So what it really means is that it's important to have something in place, whether it be a supplement or an Advantage plan, depending on your situation, that caps off that number so that it doesn't just keep getting bigger and bigger and bigger if you run into a situation where you're needing a lot of Part B services. So what if you need more help? Well, just like we say in every video, if you need more help, we're here to help you in any way that we can, and we never charge for anything that we do. There's a few ways for you to get in touch with us down in the description of this video. You can choose whichever one is best for you. If you do so, that information will come to me personally, and I'll get you in touch with the agent that is closest to you and best equipped to deal with your particular situation. Well, once again, thank you for coming by. We hope you learned something about Medicare Part B. If you have any questions, reach out and we'll help you in any way that we can. I hope you have a blessed rest of your day. Thank you. Bye-bye.